And GLP-1 medications are changing the conversation around weight loss and diabetes care, but there is some confusion around the medication. Joining us now to discuss who may benefit from these treatments, how they work, and what patients should know is Dr. Sadia Mushkabar with the Toledo Clinic. Thanks for being here today.
Thank you so much for having me.
Absolutely. Okay, first of all, we hear it gets thrown around a lot. You might even hear it as Ozempic or, all the other brands out there. But what exactly is a GLP-1? Was it first for folks with type 2 diabetes?
That's correct. It was initially, the GLP-1 is the short form of glucagon-like peptide, and there is another type, medication, which is a combination of GLP-1 and GIP agonist. So there are two different kinds, but they are made to help with the diabetes, but we also found that they are beneficial for weight loss. They also help patients who have kidney problems or heart problems or fatty liver. So that's why they're so popular and talk all over the place. And if I haven't mentioned already, weight loss.
Yes.
That's what's the main reason to get the whole media attention and all over the world, the people attention to.
I think we first started to see it with celebrities, the folks in Hollywood who were suddenly losing weight, and it was like, what was happening? I think Oprah's talked about it openly quite a bit as well.
Isn't that so fascinating and amazing? Yes. Like, what happened and what did you do? What is that magic you did?
Yeah, so does it work for anybody trying to lose weight?
So so that's where comes the art of the medicine. You have to see who's the right candidate for it, because it's a medicine. So it does have side effects. So you have to see what is the health profile of the patient and how it fits that patient health history.
Maybe they have certain things that would counteract and the risk would outweigh.
So there are certain contraindications for that. One of them is if they have MEN2 syndrome or medullary thyroid carcinoma. Patients who have had history of pancreatitis, we have to be very careful in using them. So
what are some of the biggest side effects then?
So as I said, it's like a glucagon-like peptide, and it works mostly through GI tract. The main mechanism is that it causes satiety, and it causes slowness of the gastric emptying, and it gives brain signals that GI tract is full, you don't need to eat more. So obviously the side effects are related to the same. It causes nausea, vomiting, upset stomach, constipation, sometimes diarrhea. It can also increases, in some cases, the risks of gallbladder disease or gallstones, and as I mentioned earlier, pancreatitis.
Yeah, and as you said though, every medication is going to come with side effects. Sometimes you have to weigh that though. Are you at a point where if you don't lose weight, then there are other health risks? So if somebody is thinking, I want to get on this medication, I imagine they just start to have their conversations with their GP?
Yes, I highly recommend. I mean, path towards healthy lifestyle and more healthier is always what we recommend as a primary care doctor. And I always encourage patients to talk about it. Discuss extensively what are your strengths and what are your weaknesses, or not so much what you cannot do. So there is always a conversation, and you can come up with a good plan. And if there is a role of any weight-losing medications, and if you are the right person to fit that profile, why not to try that? But do it under supervision.
Right. And does it just automatically, do you have to worry about diet and exercise then, or healthy lifestyle, or does it make it all perfect?
Well, as much as we all like to hear and say this is the magic pill, or magic injection, yes, but that's not what it is in reality. Eventually, the thing which helps the most is healthy eating and workout. Yes, it helps you to not munch between your meals, and it helps you work out more in certain scenarios, but eventually that's what is going to help you in the long run.
Okay, all right. You still have to balance, all of it out. Doctor, thank you so much for being here today. Here's contact information if you are interested in giving a call, schedule an appointment. Thanks again. Appreciate it.
Thank you so much for having
For
me.
sure.